Welcome back to Super Doc. I'm Dr. Joel Brown. I'm a family physician in rural Ontario, Canada. I'm also someone who's walked through health systems in Jamaica, the United Kingdom, here in Canada, as both a patient and a clinician. Today, I want to talk about something that has been growing quietly in me for a long time. It is about what it means to keep going in medicine when the work feels heavy. It is about how we tell the truth about that heaviness and still find small embers of hope that can grow into something brighter. I call these small things beacons of renewal. In fact, I've actually borrowed a phrase from the Honorable Mia Motley, who's the Prime Minister of Barbados, who refers to these beacons of renewal in the way that she engages about the future of the country that she leads, Barbados, and how she can motivate people to see signs of life as opportunities for hope. This episode is personal. It's for anyone in healthcare who feels tired, discouraged, or stretched to the edge and still wants to believe there is a future worth staying for. So in this first segment, I want to talk about roots in community care. My story in medicine did not begin in a hospital. It began in Jamaica, in neighborhoods where care belonged to the community first. My grandmother was the first healer I really remember. People came to her door late at night sometimes. They brought their fears, their pains, their questions. She would welcome them in. She would listen. Might boil some tea. She would pray with them. She would sit with them until they felt calmer. I didn't have language for it then. I just knew that people left her house feeling different from how they arrived. That was my first picture of what healing looks like. Years later, I became a patient inside more formal systems. I sat in waiting rooms in pediatric facilities in Jamaica or in waiting rooms in the UK, navigated clinics and hospitals here in Canada, and felt what it was like to be vulnerable inside those structures long before I ever worked in them. I trained and practiced as a doctor in rural Britain, and now I practice in rural Ontario. Different continents, different cultures, different policies. In all of these places, I notice the same tension. People want to be seen. Systems often move in ways that make that hard. Clinicians stand in the middle and feel that strain in their bodies. That is the ground this conversation grows from. The phrase beacons of renewal comes from my Caribbean imagination, and it became very real again earlier this year when Hurricane Melissa hit Jamaica. Hurricane Melissa was not just a news story. It came with a knot in my stomach when WhatsApp messages stayed on one tick for hours. It came with phone calls that would not connect. It came with scrolling for updates and holding my breath when I saw images of flooded streets and broken homes. Friends and family described sitting in darkness, hearing the wind pull at their roofs, hearing trees snap, and waiting for a sound that told them something had given way. There was a kind of helplessness in that. Even from a distance, you feel it in your chest. When the storm passed, people started looking for signs of life. In the Caribbean, there's one small sign that means a lot. A single house with its lights back on. Just one. On a street that is still covered in debris, on an island that is tired and shaken, that small light carries meaning. It says that something is working again. It says that the island is trying to rise. It does not erase the damage. It does not fix the grief. That still matters. That image stayed with me. A little pool of light in the middle of a broken scene. I began to realize that medicine has things like that too. Tiny signals inside a strained system that tell me renewal is already trying to push through. I started calling them beacons of renewal. So why talk about renewal at all? We're living through a hard time in healthcare. Clinicians are exhausted. Many talk about burnout and moral injury. Administrative work eats into the time we want to spend with patients. People wait months for services that should be available when they need them. Rural and remote communities fight just to see a family doctor. Marginalized groups deal with obstacles that feel endless. It is very easy to look at all of that and feel like the embers are dying out. I feel that pull too. There are days I come home and my body knows the cost of this work more than my mind does. At the same time, I keep encountering small moments that do not fit the story of collapse. They're quiet. They rarely make headlines. They often appear in conversations between tired people who still care deeply. These are the embers I want to pay attention to. When I look closely, I can sort them into 5 areas. I think of them as 5 beacons of renewal. They don't cancel the pain, they sit inside of it. They show me that something living is still moving in this profession. Let me walk through them. The first beacon is cultural renewal. It has to do with how we show up with each other and with our patients. My grandmother's way of caring was simple. She noticed, she listened, she did not rush the moment. She brought her whole self into the room. Over time, medicine has trained many of us to move fast, to prioritize output, to spend more time with screens than with stories. I felt myself pulled in that direction more times than I like to admit. Even so, I see embers of renewal here. I see students who expect emotional intelligence to be part of their training. I meet patients who refuse to be treated as generic. They want their culture, their history, their identity honored in the encounter. I work with clinicians who bring their background, their accent, their journey into the room, and let that shape how they listen and speak. I sit in teams that are starting to name culture, race, trauma, and power directly, instead of pretending we are all having the same experience. These are not grand reforms. They are small relational shifts, and they matter. Ask yourself, where can I bring a little more presence back into my work? Where can I slow down enough to actually see the human being in front of me? Where can I honor my own story and let it guide how I care? Cultural renewal is an ember that lives in the way we greet people, the way we speak, the way we listen, and the way we let ourselves be human in room. The second beacon is ecological renewal. In Canada, climate and health are tied together now in ways that are obvious. Smoke from wildfires fills the air. Heat waves put our older patients at risk. Floods cut off parts of our rural communities. Respiratory illness patterns shift. At the same time, healthcare produces a lot of waste and emissions, so we care of people inside a crisis that our own system helps to create. Even here, I see embers. Some hospitals are looking seriously at their energy use and their supply chains. Clinicians are forming green teams and asking hard questions about what we throw away. Medical schools are weaving planetary health into the curriculum. Communities are thinking about how to keep vulnerable people safe when the air is thick or the water rises. These are early efforts. They're far from enough, but they still matter. If you work in healthcare, is there one small change that can join or start that reduces waste or harm to the environment? Can you bring climate conversations into your teaching or supervision? Can you name climate as a health issue in your community and not just an environmental one? Ecological renewal is an ember that reminds us the planet is not a backdrop. It is a very part of every clinical story. The third beacon is social renewal. I've seen health systems from 3 countries, and inequity has been present in all of them. It shows up in who gets care late, who gets dismissed, who carries more illness, and who feels unsafe in our spaces. Some people arrive in the clinic already carrying generational trauma, racism, poverty, colonization, or the weight of forced migration. They deserve care that understands that. And I see embers of renewal here as well. Indigenous communities are building health programs that center their own knowledge, their own languages, and their own values. Black health strategies are taking shape and beginning to shift how services are organized. Rural teams are working together to secure access for people who live far from large centers. Peer support groups and community leaders are shaping mental health services based on lived experience. Some clinics are taking cultural safety seriously and are willing to reflect on their own blind spots. These are difficult conversations, but they are also very necessary. If you work in healthcare, who is missing from the table when decisions are made? Who in your community carries the heaviest burden of illness or access problems? Who would it look like to invite them into the design of care and not only into the receiving of care? Social renewal is an ember that burns in every act of justice, every hard conversation, every time we adjust our practice because a community told us the truth. The fourth beacon is professional renewal. There have been days when I finished clinic and sat in my car without turning the key, just trying to let my nervous system settle. Many clinicians know that space. We carry difficult stories, we carry grief, we carry the reality that we cannot fix everything, no matter how hard we try. For a long time, the culture in medicine expected silence about that load. That silence has harmed us. I see embers of renewal when clinicians are honest about burnout, when teams build routines of debriefing, not just rushing to the next task, when leaders adjust schedules and staffing in ways that respect the limits of human bodies and minds, when early career doctors and nurses say clearly that they want longevity and community, not martyrdom. When mentorship happens in a way that includes emotional support and not just technical feedback, these embers do not solve the structural issues. They give us room to breathe while we work on and through them. Where in your work can you tell the truth a little more plainly? Who can you check in on? Not as a colleague in role, but as a human being. Can you build one small practice of reflection or rest into your week that protects your own spirit? Professional renewal is an ember in every honest conversation, every boundary that keeps you whole, every quiet act of care between colleagues. The fifth beacon is responsible innovation. I'm someone who enjoys technology. I enjoy building tools, experimenting with artificial intelligence, and imagining new ways to solve old problems. I've also felt the frustration of systems that make my day harder instead of easier. Innovation alone, though, is not a beacon. The way we shape it can be. I see embers when AI tools are designed to take away administrative tasks and free clinicians to be present with patients. When telehealth actually reaches people in remote or displaced situations who would otherwise have no access. When digital tools are built with input from frontline staff and from patients, rather than dropped into their laps with no context. When ethicists, patients, and clinicians sit together and developers and ask simple questions like, who does this serve and who does this leave out? If you are offered a new piece of technology, can you ask how it will affect the most vulnerable people you serve? Can you ask how it will affect your own workload and attention? Can you participate in the design or testing stage of tools so your reality shapes the product? Responsible innovation is an ember that glows wherever technology is guided by empathy and grounded in real life. Across Jamaica, the United Kingdom, and Canada, I've seen brokenness in healthcare. I've also seen resilience that refuses to disappear. A patient who was once hopeless begins to smile again. A colleague feels safe enough to say, I'm struggling. And someone actually responds with care. A community designs a clinic that reflects its own culture. A learner chooses family medicine for reasons that have depth and courage. A small tool saves a clinician enough time to get home in daylight. These are small things. They do not erase the heaviness. They sit alongside it, though. To me, they feel like embers in a fire that is still alive. When we notice them, feed them, and protect them, they grow brighter. They become beacons that guide us through the dark parts of this work. It can feel as if medicine is only a story of collapse. I see another story running at the same time. A story of transformation that is messy, painful, and very incomplete, yet still real. The beacons of renewal are cultural, ecological, social, professional, and technological. At the center of all of them is something simple. Human beings refusing to stop caring. We rebuild medicine like we rebuild after a hurricane. Light by light, house by house, act by act. Thank you for listening. If this resonated with you, share it with someone in healthcare who needs to be reminded that there are still embers worth tending. And if you have a story of renewal in your own practice or community, I'd love to hear it. This is Super Doc. I'm Joel. Take care of yourself. We need you.